Matthew Bryan's picking up Tamiflu for his sister. She sent him here when her symptoms didn't clear up. He says she's concerned but not alarmed.
A lot of people I know have got it, but obviously if they get the right medication then it should help. So yeah, she's not panicking, she's in good spirits. She's not that ill, but she just wants it just to get make her feel better.
The clinic is an important part of the government's response to the pandemic. This is one of the many drug distribution centres set up in public buildings across the UK. People coming here are assessed before being given the antivirals for their friends or family. And the staff here say since the national hotline opened, there's been a steady increase in the number of people coming. They're expecting 300 people here today. That number's doubled since last week.
We are not seeing panic, but we are seeing concerns. A lot more people are coming in. And we've even had more in since Tuesday when they have been going online and booking themselves through.
But despite the advice, there are fears public panic is now becoming an equally dangerous symptom of swine flu, and that's something ministers want to stop. Speaking to The Observer, the Health Secretary Andy Burnham says, if people are made unnecessarily anxious, it makes the lives of NHS professionals, who are already under enormous pressure, far more difficult as people become unduly worried. It's hoped the teams manning the government's swine flu helpline will lighten the load for GPs at least. In its first day of operation last Thursday, the hotline and website gave out Tamiflu to 5,500 people and assessed 58,000 for the virus. But despite the new service, some say fear is still a worrying factor.
Well, the arrival not just of swine flu, but with the panic that it's engendering has meant a lot less time, a lot fewer resources to deal with all the other problems that people have. And it's meant necessarily that we're getting tunnel vision and just seeing everything in terms of is it swine flu or isn't it? Well, of course, there are many, many other conditions that people have.
This week, a parliamentary committee will for the first time look into how ministers prepared for the pandemic. The House of Lords Science and Technology Select Committee will reportedly question why there were delays in setting up a flu helpline when one was originally promised by April. It'll look at why it's been manned by staff who'd been given 1 day of training, and there'll also be questions about the standard of advice given to the public after contradictory recommendations were made to pregnant women. Patients are still being advised to contact their GP if they have serious underlying illnesses. But as the number of people infected grows, controlling concerns could prove more challenging than treating the disease.